This is Jaffe method and colorimetric method also, and it's a kinetic method, but it has 2-point fixed time interval. It has 2-point fixed interval is there, so it is a type of kinetic method. So whatever creatinine present in the sample, it will react with alkaline picrate. So one picrate solution will be there and another alkaline reagent will be sodium hydroxide, and together it will form creatinine picrate. It will be orange red color complex. So principle is the intensity of the color will be proportional to the concentration of creatinine present in the sample. And another thing you have to tell, 2-point fixed time interval. One is at 30 seconds, another is at 90 seconds. This one also you have to add in principle. So this 2 point we will measure the absorbance, and if this one the first absorbance, this is the second absorbance, we will measure delta absorbance, that is A2 minus A1. So 2-point fixed time interval you have to see, and that is the reaction. Reagent is R1, R2, and one standard will be there. R1 will be picric reagent, R2 will be alkaline sodium hydroxide alkaline reagent, and that creatinine calibrator or standard, it will be 2 milligram per dl. 2 milligram per dl. Is there any problem? Concentration? No. This is the standard. Everywhere I am multiplying on standard in the calculation. The standard concentration is 2 milligram per dl. That is the creatinine concentration that is given in the sample standard bottle. Okay. There is some chromogen which will interfere the result. It's like 20 second, at 20 second acetoacetate will be measured. So, and somewhere in between also protein also will interfere. So we want to nullify that effect of the acetoacetate and protein. So we are measuring at the fixed time interval at 30 seconds and 90 seconds. Okay, I'll tell you after. We are not incubating outside. We will give it in the machine. Okay, machine will provide temperature and pH at which the reaction will occur. Kinetic, this is the one type of kinetic method. Kinetic method, I told previously about endpoint method. Kinetic method where substance and enzyme affinity is less and Km is more, and it is not linear. Normally it's not linear. It will be, the graph will be linear endpoint reaction, it will be like this type of graph, and for kinetic method it will be like this type of graph. Everywhere wherever the result they have taken the value or absorbance value, there will the dot will come and it will be, the curve will be like this in kinetic, and in endpoint it will be like this. Kinetic method, the enzyme and substrate affinity is low and Km value is more. The reaction OD is increasing but at a decreased rate. So it's not straight line, it is little bit curved. Principle of Jaffe's method, creatinine in alkaline picrate means picric acid will be there and sodium hydroxide will be there together. It will form creatinine picrate, and that is, it will give the color red or orange or reddish orange, whatever you can say, and we'll measure at fixed point 30 seconds and 90 seconds and not outside. The machine will decide, because if you change the temperature and pH outside, it can create problems. So machine will decide when it want to, means it will decide its time, temperature and pH, and it will measure the value. There is R1 you can say, R2 you can say, and you can say standard. R1 is, you can say this is picric reagent, picric acid reagent, and this is alkaline reagent. So sodium hydroxide is present, alkaline reagent, and standard is 2 milligram per dl. This is the creatinine they have provided into the standard bottle, so we can calculate it. And while making, okay, I'll tell you later. Working reagent you will have to take, make. So we will take 500 microliter of R1 and 500 microliter of R2. We'll make it up to 1000 ml or 1000 microliter or 1 ml. Working reagent. Here one side will be optical density and one side will be concentration. X and Y, one side is optical density and one side is concentration. So is it clear? Okay. Now creatine with a help of creatine kinase So creatine, with the help of creatine kinase, it will form phosphocreatine. Okay, phosphocreatine, if phosphate is removed, it will form creatinine, and creatinine spontaneously also, after removing water, it forms creatinine. Creatine is formed in pancreas, liver and kidney. And it will go to muscle or brain. There it will be phosphorylated to form phosphocreatinine. Now phosphocreatine, it can give ATP, so it can provide energy. So in muscle and liver, muscle and brain, it will form phosphocreatine, and there they can give ATP and then convert to creatinine. So creatinine, now it will be excreted through kidney. So whatever the creatine is forming in liver, pancreas and kidney, it will go through blood and will reach to muscle and brain. Okay, and there it will be phosphorylated. Creatine, how it's formed, if you can remember 3 amino acid, glycine, arginine and methionine. Glycine plus arginine, here will be transamidation. It will form guanidoacetic acid. And here S-adenosyl methionine will added, so methyl will be added into this, and this will give rise to creatine. Transamidation, that is not transamination, this is transamidation. Glycine and arginine, G and A. Then guanidoacetic acid. S-adenosyl methionine. It is methyl donor. So guanidoacetic acid, after working with SAM, it will form creatine. So creatine is synthesized in kidney, liver and pancreas. Anywhere? You have to ask. Transamidation. Guanidoacetic acid. S-adenosyl methionine. So nitrogen product produced in body, you can say urea, creatinine and uric acid. Nitrogenous product produced in our body, urea, creatinine and uric acid. Okay. You will measure, estimate serum creatinine in serum or plasma, heparinized plasma. And the wavelength will be 490 to 510 nanometer, but this is kinetic, one type of kinetic method. Other endpoint method also there, the wavelength will be up to 546 nanometer. And this is a green filter. This is color is red or orange and the filter is green. Wavelength is 490 to 510 nanometer. 490 to 510. This is for this method, Jaffe's method, kinetic method, but it can go up to 546 nanometer in other kinetic endpoint method. There it can goes up to 546 nanometer, but here it is 490 to 510 nanometer. Okay. So principle is creatinine reacts with alkaline picrate forming a red complex. The time interval chosen for measurements avoids interference from other serum constituents. So acetoacetic acid 20 at 20 second and other constituents like protein, it can interfere. So we are measuring at fixed time interval, 2-point fixed time interval. fixed interval. Okay. So what is the clinical importance, significance? If you have more muscle mass, the creatinine will be more. So it is more for male and comparatively lesser in female and children. And if you have any perfusion problem in kidney, like renal failure or dehydration, shock, even heart can't pump properly and provide blood to kidney, like heart failure, there also creatinine will be more. So increased creatinine seen in old age also. Old age, what happens? Nephron will be gone. It will be destroyed. For some other disease also will be there, maybe diabetes or some other immunological disease. So old ages normally creatinine will be more. Male also more renal disease and also glomerulonephritis, renal failure, urinary obstruction. When the creatinine cannot be excreted, if there is urinary obstruction, their creatinine will be more. Congestive cardiac failure, it will be more. Dehydration, shock, and some of the medication also cause increased creatinine. Yes, dehydration, what happens? Whatever is there in creatinine, the water content in the body is more, so it is increasing in concentration into the body. Old age, male, dehydration, you don't have much water in the body, so concentration is more. Shock, then congestive cardiac failure, some medicine also, and glomerulonephritis. These are some of the causes for increased creatinine concentration. Shock, there will congestive cardiac failure. Heart can't pump properly, so blood is not going to the kidney. So inside the body, concentration of creatinine is becoming more. Medication and glomerulonephritis. You can see the table into the, in Vasudevana, what? This is increased creatinine into the blood. Yeah, okay. Increased creatinine into the blood. Decreased creatinine in blood seen in female bedridden patient. Malnutrition. Children also. And some of the drugs also. Drugs, if you have to know, check it out, the table in Vasudevan. Okay, some drugs cause increase in creatinine and some drugs cause decrease in creatinine into the blood. Malnutrition. If you have increase in creatinine, means 50% of nephron is already affected and you will take the value if it's creatinine more than 1.5 milligram per dl. More than 1.5 milligram per dl if creatinine is in serum you are getting it. So that time more than 50% nephron is already destroyed. That is the reference range for male, female and children. 0.7 to 1.4 milligram per dl for male, female 0.6 to 1.1 milligram per dl and children 0.4 to 1.2 milligram per dl. This one written into the kit, this one. You can set the value according to your lab, according to your community, race. Principle হচ্ছে creatinine in the environment of alkaline picrate, it forms creatinine picrate. The creatinine picrate gives the color. And we measure the absorbance at 30 second and 90 second. And we get the result of delta absorbance A2 minus A1. And I didn't do the calculation till now, I will do it. Okay. And urine, it is 15 to 25 milligram per kg for 24 hours. Serum. Serum or plasma? You can see? Yes. Per 24 hours. And another thing, when muscular dystrophy is happening, beginning, there will be muscle destruction, that time creatinine will be more. But when the muscle dystrophy is already happened and as a constant position it has already come, that time the creatinine value will be less. And for single result, you will not tell the patient has increased creatinine or decreased creatinine. You have to correlate with clinical interpretation also and other investigation, clinical interpretation, and better to take another result. Single result, you will not rely on it because if someone has taken already protein food, increased protein diet, there also for 6 to 12 hours mostly, there will be increased of level of creatinine. So, single value is not needed and not appreciated, and you have to take that, they'll see also that patient has not taken protein food. creatinine clearance for drug administration. Somebody is already having kidney problem, so you will check creatinine clearance CCR, and there you will apply this Cockcroft Gold formula, but there is other formula also that is used, and this is one of the formula we can use. This is 140 minus age into body weight into 0.85. For female it's 0.85 and for male it's 1. It's for female, and for male it's 1. 72 into serum creatinine. Serum creatinine, whatever the result you have got, and from that you will get the creatinine clearance. So you have to check in what range it is there. So if you they will give the range from this clearance to this clearance, you can give the full dose, and after that you can give the half dose, you can give the 1/3 dose. They will predict, there is one chart. So you have to check and you will prescribe the drug accordingly. 140 minus age into body weight into 0.85 divided by 72 into serum creatinine. In exercise, there can be slight increase, it's written in Vasudevan, slight increase in creatinine, creatine and uric acid. Slight increase, but otherwise we don't appreciate much, but slight increase is there. Exercise increase, slight creatinine and slight increase in uric acid and slight increase in creatine. If result is not coming properly, what you will check? You will check the instrument, you will check the reagent, and you will check the calibrator also. There should not be any turbidity or particulate matter in the bottle. So you have to be careful if result is not within limit, or when you are doing the calibration you can't do properly. So you have to check that time instrument, reagent and calibrator. Taste the sample or taste sample. 1000 is working reagent. Here you will add R1 and R2. This is 500 and this is 500 microliter. Together will form 1000 microliter. Working reagent, WR, working reagent. Distilled water for blank. This one you will not write here. This one you will remember. Working reagent we are making by adding 500 microliter of R1 like picrate reagent and 500 microliter of R2 like alkaline reagent, sodium hydroxide. This is the procedure. Now here you are feeding into the semi-auto analyzer. At 30 seconds it is giving the result A1 absorbance. At 90 seconds it's giving the absorbance A2. So you will measure delta absorbance, that is A2 minus A1, and calculation is delta absorbance of test minus delta absorbance of blank delta absorbance of standard minus delta absorbance of blank into 2, because standard concentration we have taken 2 milligram per dl. Whatever the result will come, that will be in milligram per dl. Here absorbance, that unit is gone, and this is concentration unit will be milligram per dl if you are taking. So result will be in milligram per dl. Means A2 minus A1. I am taking the result at 30 seconds and at 90 seconds. The machine will incubate by itself at fixed temperature, fixed pH, whatever it needs. It will react. It will act like incubator and it will give the absorbance. In this kit, 35 milligram per dl, up to that much creatinine can be measured. And there is some interference also. Some colored reagent like hemoglobin, 1 gram per liter, or bilirubin, 55 milligram per dl, and lipid less than 4 per liter will not interfere. These two will interfere: hemoglobin 1 gram per liter, bilirubin 55 milligram per dl, and the lipid less than 4 gram per liter will not interfere in that. হ্যাঁ, যদি ওই স্যাম্পলের মধ্যে যদি কন্টামিনেশন থাকে বিলিরুবিন এন্ড হিমোগ্লোবিন, it will change the value of creatinine, serum creatinine or plasma creatinine. Bilirubin 55 you are telling about. If cardiac arrest for newborn more than 20 it can be there, and they have given if any contamination from outside happens, so 55 milligram per dl can cause problem. Newborn baby, they can have increased bilirubin. Cardiac arrest, what? 4 gram per liter, it will not interfere with the result. If above 4, it will interfere. And some drugs also can interfere. That drugs list is not given here. Some drugs also can interfere. That drugs list we have to find out. If you say that some drugs also can interfere, that is enough, I think. Drugs, they have not given the list, and that we have to check. Okay. Here that Vasudevan, that they have given some drugs name, right? There if you check, decreased creatinine seen in thiazide and vancomycin, and increased creatinine seen in amphotericin B, captopril, cephalosporin, and kanamycin. So some of the drugs can interfere the creatinine level. It's given in the kit. I'm blind about it. I don't know. It's given in the kit. 55 milligram per dl bilirubin will interfere with the result. Highest bilirubin, how much it can reach? I have to check actually. 1.2 milligram per dl, normal range 0.2 to 1.2. Newborn baby carnictidas more than 20, it can come. Yes. Interference, hemoglobin 1 gram per liter, bilirubin 55 milligram per dl, interfere, lipid less than 4 gram per liter, do not interfere. A list of drugs and other interfering substance with creatinine determination has been reported. And this is a special types of kinetic method. Two-point fixed interval type of kinetic method, because 30-second and 90-second, so 2-point fixed interval kinetic method. Normally is creatinine not reabsorbed and not secreted, but somewhere it's written it's slightly secreted. Okay, so very less. If you say it's not reabsorbed, not secreted also, fine. In Vasudevan it's there, you check it out. So I am telling at 30-second and 90-second, what can interfere? One can be acetoacetate at 20-second and another can be protein. Okay, one is acetoacetate at 20-second, another can be protein. So you will write the method, then you will write the principle, then you will write the reaction, then component composition, reagent composition, then a reagent, then you will write procedure, calculation, you will write result, interference, you can write first interference, then result, then reference range, then clinical importance. Clinical importance. Calculation er pore you can write interference, then you can write result, reference range and clinical importance. Acha. Anything else? Tell me the how creatine is formed. The amino acid, name of the amino acid, which can. And the color, what is? And the cuvette light path will be 1 centimeter. Okay, cuvette light path will be 1 centimeter. 1 centimeter light path for the cuvette. Now you can say the clinical importance where creatinine is less and creatinine is more. For female children, malnutrition, it is less, and shock, dehydration, congestive cardiac failure, it's more. Male also it's more, old age also it's more, because the nephron will be that time damaged most of the time. Like after 70, you can expect it to be increased. And some of the drugs which can cause decrease the creatinine, and some of the drugs can cause increase of the serum creatinine. Where creatinine is formed? Liver, kidney and pancreas. And from there, through blood, it goes to muscle and brain. There it forms phosphocreatine, and phosphocreatine can give energy. So muscle contraction also it gives energy. So phosphocreatine, from that also creatinine can be formed, and from creatine also, after water removal, creatinine can be formed. And wavelength 490 to 510 are some of the 546, 540, 546 you can say. Actually 546, one of the higher range of filter, and this is the green filter if you have to remember.